Hello, my name is Mahim Ali. I'm a Tier 2 specialty dentist in oral surgery in Shropshire and Staffordshire. The aim of this video is to provide guidance to new applicants on completing the application process and the interview. You'll be asked to submit a digital application. All documents should be returned in a single email. On application, you'll be provided with guidance forms for IMOS Accreditation. The form has clear appendices showing what should be in each section. This should include a completed application form including CV, a relevant logbook of education and training, a reflective clinical logbook demonstrating a current, relevant and appropriate case mix and complexity of level 1 and 2 cases that should be treated by the applicant to an appropriate standard and outcome. Additional supporting evidence, and finally, your declaration. Your portfolio should be clear, easy to read and well organised. I found having contents pages indicating what is in each section helpful. Your CV should be in chronological order and there is a template provided for personal information. The portfolio of evidence can be demonstrated through an education and training logbook. A wide variety of evidence should be provided, including certificates of relevant CPD, courses and conferences attended. Additional supporting evidence such as clinical audits, service improvement initiatives, patient feedback forms, relevant posters and presentations can be included here. Platforms such as ISCP are useful in collating evidence of teaching and peer review. For your clinical logbook, it's vital you demonstrate competencies in relevant Tier 2 procedures. There should be a wide variety and appropriate number of cases from the last 3 years. A summary from your logbook should be included. Oral surgery competencies that should be included are extractions of erupted teeth and the management of complications and post-operative problems, including hemorrhage and odontogenic infections. The surgical removal of buried roots, uncomplicated third molars, including bone removal and uncomplicated supernumerary teeth. Surgical endodontics for incisor, canine and premolar teeth. The surgical exposure of teeth to include bonding or orthodontic brackets and chain as part of an orthodontic treatment plan. Diagnosis and treatment of localised odontogenic infections and demonstration of understanding of when an urgent referral is appropriate. The diagnosis, investigation and management of oral mucosal disease, including referral to the appropriate specialist when necessary. Minor soft tissue surgery. Demonstration of knowledge and understanding of the prescription of therapeutic agents. Management of dental trauma, including the reimplantation of Evel's teeth. Recognising patients with craniofacial pain, including the initial management of disorders of the temporomandibular joint, and be aware when referral to a specialist is more appropriate. The management of patients on novel oral anticoagulants, antiplatelet drugs, anticoagulants, bisphosphonates, and monoclonal antibodies. Reflections should identify what you could have done differently to prevent suboptimal outcomes. And evidence to indicate any supporting competencies also include case-based discussions, training under direct supervision, work-based assessments, and procedure-based assessments. The interview process. The interview is conducted on Microsoft Teams by the local IMOS Accreditation panel. This includes specialists and consultants from a range of dental subspecialties and oral and maxillofacial surgery across the region. The interview process. The interview is conducted on Microsoft Teams by the local IMOS Accreditation panel. This includes specialists and consultants from a range of dental subspecialties and oral and maxillofacial surgery across the region. The interview is approximately 20 minutes long. Questions are based from your portfolio of evidence, so it's important that you know it well. It's helpful to have it to hand. I hope this video has given you some helpful hints and good luck with your application.